In other health news, around 10,000 women in Illinois are diagnosed with breast cancer every year. I spoke with staff at Sarah Bush Lincoln Health Center about a new tool that may help reduce that number and save lives. Breast and imaging navigator Cindy Beasley says Sarah Bush has a new system to get patients further imaging even if their mammograms are clear.
A new software system that we have is called Tyracusic score, and what that does is it assesses the lifetime risk of a patient to develop breast cancer.
Beasley says factors that go into the score are family history, personal history, and breast density. She says if a patient scores above 20%, they will be given the option to have further testing.
We just have to tell them, your score's a little bit high, you're at a higher risk of developing breast cancer. With that information, the patient and her primary care provider can determine whether they feel like it's necessary.
WEIU TV news director Kelly Goodwin says even though her recent mammogram was clear, she scored high enough to have extra imaging.
But 2 weeks ago, roughly, I got a phone call from my doctor's office, and they had indicated that because of my family history, because of my breast being dense, and because of my age and some other factors, they wanted to see if I would be interested in taking the next step and going beyond a mammogram and having an MRI done.
Goodwin says she's a little nervous, but is relieved to know there is a program that gives women and doctors a better look.
I always tell my first-time patients it's not going to be nearly as bad as you think it's going to be. And I would say 99% of the time at the end of it, the patient's like, well, that was nothing like people told me.
Health officials say women should start doing yearly mammograms at the age of 40. Beasley says it is best not to have gaps between the yearly imaging because the earlier the detection, the better protection.